Hello everyone, my name is Dr. Omende and I'm going to discuss on the pelvic viscera. Quite a long topic, but I will try my best and be very clear. So we'll begin with the rectum. The rectum is located in the true pelvis. By now we've already discussed what the pelvis is, what the perineum is, so it will be easy to relate with these terms. So the rectum is located in the true pelvis and it usually extends from S3 vertebra to the tip of the coccyx. It usually follows the curve of the sacrum and coccyx and it's S-shaped. Usually there are peritoneal reflections over the rectum. The superior third of the rectum is covered by peritoneum anteriorly and laterally, while the middle third is covered only anteriorly. The inferior third of the rectum is not covered by peritoneum. In males, anterior to the rectum is the rectovesical pouch, while in females, anterior to the rectum, the peritoneum folds to form the rectouterine pouch of Douglas. These pouches permit rectal distension. So this shows the peritoneal relations. You can see on the upper part of the rectum, it's covered by peritoneum anterolaterally, but the lower part is not covered by peritoneum. And this is a male pelvis, so this is the rectovesical pouch. So this is the peritoneum. You can see the reflection has formed the rectovesical pouch. So again, this is the rectum. You can appreciate that. These are the blood vessels supplying the rectum. This is the middle rectal artery from the internal iliac artery. You can appreciate the plexus of nerves that are located posterior to the rectum. This is obturator internus muscle. This is iliococcygeus, that is part of the levator ani muscle. So, and then appreciate the upper part of the rectum is covered by peritoneum anterolaterally. So the relations of the rectum in males and females are different. So anteriorly in the males, you have the urinary bladder, the terminal parts of the ureter, the vas deferens, seminal vesicles, and the prostate gland. While in the females, anterior to the rectum, we have cervix, the vagina, rectovaginal pouch, and rectouterine pouch. Posteriorly in both male and females, there is a sacrum, coccyx, anococcygeal ligament, and branches of superior rectal artery, as well as termination of the sympathetic chain. And laterally, we have the sacral plexus, branches of internal iliac artery, piriformis muscle, and istiorectal fossa. So that's just a diagram to show you. This is the rectum. This is a female pelvis because we can see the uterus and vagina here, and that's the urinary bladder. So the sacrum and the coccyx are posterior to the rectum, while the uterus and vagina are located anterior to the rectum. Then superiorly you have the part of anteriorly you have rectouterine pouch with coils of the small intestine. This is male because there's prostate here. That's the urinary bladder. So anterior to the rectum is the prostate, okay, the urinary bladder and the prostate. Posteriorly you have sacrum and coccyx. All right, then this peritoneum covering the upper part of the rectum, the rectovesical pouch with coils of the intestines there. So this is the hemipelvis of male subject. So the rectum is supplied by superior, middle, and inferior rectal arteries. Superior rectal is from inferior mesenteric, the middle rectal is from internal iliac, while inferior rectal is from internal pudendal artery. The veins correspond, and these veins of the rectum usually are anastomose, making the rectum to be a site for portosystemic anastomosis, where some veins will drain into the portal system, okay, while some will drain into the vena cava system. So superior rectal artery runs together with superior rectal vein. Superior rectal vein drains into inferior mesenteric vein, which drains into the portal system, while the middle and inferior rectal veins will drain into internal iliac veins into the inferior vena cava. So the rectal venous plexus is usually joined by vesical venous plexus and uterovaginal plexuses of veins. The superior part of the rectum drains its lymphatics into pararectal lymph nodes that subsequently drain into inferior mesenteric lymph nodes, while the inferior part drains into internal iliac, common iliac, and into aortic lymph nodes. The innervation of the rectum is by autonomic nervous system from the inferior hypogastric plexus. So that just shows you that the rectum is supplied by superior rectal from inferior mesenteric, and we also have some branches from internal iliac arteries, the middle rectum from internal iliac, and also the inferior rectum from internal pudendal. And this is the plexus of veins around the rectum, which will drain into inferior mesenteric vein to the portal system, and the middle and inferior rectal veins drain into internal pudendal and internal iliac vein into the vena cava. So the rectum becomes a site for portosystemic anastomosis. Then we discuss the anal canal. It's a terminal part of the large intestines that extends from the anorectal angle. This is the anorectal angle. It's usually marked by the puborectalis muscle and descends posterior inferiorly between anococcygeal ligament and the central perineal tendon. So it's usually surrounded by the levator ani muscle. We have anal columns that are a series of longitudinal mucosal folds, and in the superior half of the mucous membrane of the anal canal. The anal columns contain terminal branches of superior rectal artery and vein, and the superior ends of the anal column form the anorectal line where the anus joins the rectum. So this is what I'm alluding to. These are the anal columns. They're called columns of Morgagni. You can see them there. And then inferiorly, we have the dentate or the pectinate line at that portion. So we are saying the anal columns are longitudinal mucosal ridges or folds located in the superior half of the mucous membrane of anal canal and contain terminal branches of superior rectal artery and vein. The superior ends of the anal columns form an anorectal line. Pectinate line is the inferior comb-shaped limit of the anal valve at the junction between superior part and inferior part of the anal canal. So above the pectinate line receives visceral innervation because it's from hindgut derivative, and below pectinate line receives somatic innervation because it's from proctodium. So this is embryonic development. Part of the anal canal above pectinate line is from the hindgut. So innervation will be visceral from autonomic nervous system. Below pectinate line is from proctodium, so its innervation will be somatic. So this is somatic from proctodium, that's from hindgut. This is the limit for the pectinate line. So we have two anal sphincters, the internal and external. The internal is involuntary, so it's usually supplied by autonomic nervous system. It will be stimulated by the parasympathetic nervous system, usually surrounds the superior 2/3 of the anal canal. The external sphincter, on the other hand, is voluntary. The external sphincter is voluntary, and it's supplied by S4 nerve via the inferior rectal nerve. So the functions of the external sphincter is to close the anus and draw anal canal anteriorly and increase the anorectal angle. The deep fibers are assisted by puborectalis. So this is the internal sphincter. It's involuntary, innervated by parasympathetic, actually autonomic, and this is external. It has three parts: the deep part, the superficial part, and the subcutaneous part. These three form external sphincter, and it's usually voluntary muscle. The anorectal ring comprises of puborectalis muscle, external anal sphincter, and involuntary fibers from internal anal sphincter. Okay, so the anorectal ring will have the three at that portion. So this will be your internal anal sphincter and the three parts of external anal sphincter, the deep, the superficial, and the subcutaneous, the three parts of external sphincter and part of the puborectalis muscle. So it just functions to maintain the anal continence. The external anal sphincter is voluntary and surrounds the inferior third of the anal canal. It lies in the perineum and has three parts: the subcutaneous part, superficial part, and the deep part. So the subcutaneous part surrounds the anus and has no bony attachment, while the superficial part extends anteriorly from tip of coccyx and anococcygeal ligament around the anus to central perineal tendon. The deep part arises from central perineal tendon and fuses with puborectalis or levator ani and blends with it. So the three parts are innervated by perineal branch of S4. This is the external sphincter with deep superficial and subcutaneous parts. And also perineal branch of S4 and inferior rectal branch of pudendal nerve. The blood supply of anal canal is by superior, inferior, and middle rectal arteries, and superior rectal supplies above pectinate line, inferior rectal below pectinate line, and middle rectal anastomosis between the two. The veins will correspond. So the lymphatic drainage above pectinate line is to the internal iliac, common iliac, and subsequently aortic lymph nodes, while below pectinate line, the lymphatics go to superficial, to deep inguinal, and to the iliac lymph nodes. Innervation above pectinate line is via autonomic, so it's sensitive to stretch, while below pectinate line is somatic by inferior rectal branches of pudendal nerve, and it's sensitive to pain, touch, and temperature. So again, the rectal vessels that supply anal canal, and this is how the above pectinate line, they go to iliac nodes, to lumbar nodes, aortic nodes, while below pectinate line, they go through superficial to deep inguinal lymph nodes. Then we discuss the vagina. I think I can tackle that in the subsequent lecture.